So how can we limit our risk of infectious diseases? Our expert, Radhika Iyer, is here to tell us all about the data behind the diseases and why case investigators are like disease detectives. Also, how big a toll did COVID take on health workers, and what can we learn from that ordeal moving forward? Plus, Ange and I take a quiz to find out what we know about food nutrition labels. We may not be the best at this, so play along and see if you can do better than we did. All that and more coming up on Health is Real. Come in, stay a while. Andrew Stinson alongside Zach Watson and Angela Ta. This is Health is Real, a podcast from Franklin County Public Health, coming to you from Memorial Hall in downtown Columbus. Zach, how's it going today?
It's going great. Today is a magical day, as is every day.
Great to hear. Angela, how's it going for you?
Great. Also magical, I think.
You can't take mine. You got to come with a different one.
Oh, okay.
Yeah.
Wonderful.
Wonderful.
Wow.
Yeah.
Okay.
Doesn't have as much.
Well, I'm excited to be here today and to introduce our guest, Radhika Iyer, who is the Infectious Disease Program Epidemiologist and Supervisor here at Franklin County Public Health. How's it going today, Radhika?
Great. It's an amazing day. Choosing something different than Angela and Zach.
There you go.
Good. See, you know what? You've got your thesaurus on you.
I was going to
That's all
say
that matters.
thesaurus. That's right. That's what we've all got on hand at all times, thesaurus. So, Radhika, tell us a little bit about what you do on the infectious disease team here.
Awesome. So I am the Infectious Disease Program Supervisor here at Franklin County Public Health. And part of my job, and I will say my team as well, because we work collectively together on infectious disease investigations for our county. So what that means is having information and knowledge to understand what diseases are spreading and what that surveillance numbers look like for our community and who's at risk within our community and what kind of prevention and control strategies we could have in place in our community to make sure our community is safe and people have all of the information to understand.
Excellent. Great stuff. And what is IDRS?
So IDRS is Infectious Disease Reporting System. So that's actually a combined reporting system for Franklin County and Columbus City to do reporting from the provider who's doing the reporting to us. So it's a methodology of reporting. So it's not, when you hear the word system, you might think data systems. It's not a data systems, it's a methodology. It's a combined methodology to report to us so that between the two health jurisdictions, there's no confusion on the provider end or the laboratory end when they're trying to report information to us. So it's been in place for a couple of decades now, and it's been really helpful to have that in place as a single point of contact.
Yeah. So it sounds like you're saying you kind of get the information from providers. Is that how you find out about new diseases? Is like someone goes to the doctor and is like, and then the doctor's like, that's icky.
Yes.
And then they tell us about it?
Yes, absolutely. So the diseases that we investigate and follow up are required by law that they're reported to us. It's in the Ohio Administrative Code.
Okay.
So we are the local authority to make sure we're collecting all the surveillance information on that specific disease, doing the appropriate follow-up, working with our citizens to make sure they have good understanding about the disease and the additional follow-up that they need to do once they're infected with a specific disease.
So how many diseases are in the Ohio Advice Code? We talk
A lot.
Ballpark, like 100 that you guys track?
Oh, yeah, definitely more than that.
Whoa.
So it's reportable conditions / diseases.
Okay.
So there are specific diseases that we are, in general, public is aware of.
Yeah.
For example, measles.
Right.
We think of measles infection, and that's a disease. But there are conditions that are caused by specific pathogens that are reportable as well.
Interesting.
So a specific pathogen might cause a certain type of response or a certain type of infection in a human being. So that would be like a condition that would be reported to us. So we usually call it reportable diseases / conditions. That's how it's framed. So we have this huge list It's called Know Your ABCs. That's published by Ohio Department of Health.
Okay.
And it's literally Know Your ABCs of different classifications of diseases. And it's a list of A through Z list of diseases that are reportable. There are things that you think of that are infectious or communicable within the community. Not everything is reportable to us. So there's a certain amount of infection that you might have in the community that's not reportable. For example, skin infections like MRSA. It's not a reportable condition. It's just something that's happening in the community. Individuals can seek treatment working with their provider, but public health doesn't do any type of follow-up for that. But there are other types of staph infections that are reportable to us depending on the severity of the illness.
Okay.
Left you puzzled, didn't
Yeah, it did. Yeah, because how they define like what's reportable and what's not reportable is just really interesting to sort of think through, right?
Yes, it's what we're looking at is the risk of that specific infection for the community.
Okay.
And, is there treatment available that individuals can get from their medical provider readily, easy to control, maybe not as much of a public health impact. So when you're thinking about public health impact, we're thinking of how quickly can a disease spread and how many individuals can be affected by that. So a lot of that is part of that equation, and it goes back to the epidemiology of infectious disease and how all of that plays together and how surveillance is done on a specific infection to understand.
So, Radhika, what would you say to someone? I mean, there's a lot of information out there, a lot of misinformation sometimes out there, and people can be afraid. What would you say to someone who is scared by all the different diseases that are out there and sort of balance sort of being aware but not being fearful?
It is overwhelming. So definitely information, the right information is key in getting that good pulse on what's happening in the community. So, if someone is really curious in what's happening, I think they should look at the local data to see if that disease is really affecting the locality where they live in. We hear about lots of other diseases that are happening outside of U.S. or even other parts of U.S. that you might not be affected by. So understanding locally what's happening is important. Most public health agencies at the local level throughout United States will have some sort of data on their website, which you can kind of make yourself aware to say, okay, what is the local spread of certain infectious diseases? And most public health agencies will do a yearly report to report what's happening. You can pretty much find that in any local public health agency or public records requests. So you can always reach out to your local public health and say, hey, what does the surveillance data look like? You're not asking for any health information on individuals. You're just asking for surveillance data to see what that looks like. So from there, you can kind of learn a little bit more. We have our resources from CDC or the state public health agency. Those are credible sources of information to kind of get an idea of what is the disease, just learning the basics, how it's spread. And the important part is, are you really at risk? There are a lot of diseases out there, but that doesn't mean we're all at risk. Individual risk can vary based on your activities, based on the behaviors and things that you're involved in. So I would start there and then kind of understand what can you do in addition to that too. If you are at risk, what can you do to limit that risk?
I just wanted to jump back into something you said in your response, the public record request, right? So that's something that information people can always request from us. However, if it's about surveillance data, we're not releasing the names of people who are sick. We're just releasing the numbers, correct? Okay.
Correct. We're just releasing the numbers.
Yeah.
Long ago when we didn't have way to release the numbers on a website or whatever, reports would be prepared quarterly, yearly, and they would be published out. But now with the data and technology that we have dashboards and on our website, you can look at current information for data from last month or last quarter that's readily available for you to view that data.
I know you've sort of did a high level description of this earlier, but for the folks at home, what's the process like? I know that when we have, I'll give an example. If we have some sort of, whether it be measles breaking out in a certain school district or set of localities, describe the process for what your team does when that sort of thing happens.
Yeah, so we will start with a case investigation to understand what the spread's been like. So that's first step before we would put out any messaging. So we'd like to make sure our messaging is very targeted to those who are exposed. Unless there's no way to do that, then you might have seen in the most recent time, since measles has started back up here in the U.S., that you would see you've been to this mall or you've been to this movie theater that you're exposed. Those type of general messagings could happen, but we would start out with a full case investigation to have a full idea of what the exposure's been. And from there, we will address the individuals that have been directly exposed. If not, then we would do more of a public notification for exposure. So always start with case investigation, collect as much information, make sure it's credible information before we would do any type of messaging.
Yeah, and it seems like, as you're doing case investigation, it's sort of almost like disease detectives. What's the conversation like with, I would assume you have to talk to folks and see where they've been, where, trying to track down where they got a certain condition or virus from or something like that. Mm-hmm. What's that process like, specifically talking to folks? So is it usually, you're just trying to get to the details? Is there a little bit of like sort of a careful touch involved because maybe this person is sort of scared of what they have or something like that?
Yeah, definitely. So on my team, our infectious disease epidemiologists and our nurses, they are well-trained in doing phone interviews with the cases or the parents of a case that we're investigating. And we have a process and protocol for every specific disease. And we have a questionnaire that's designed to collect that information for that disease. So for every disease, we have to look at the epidemiology of the disease. So the incubation period and exposure periods are very important to collect that data. So our questionnaire is designed to collect that information. And from there, we can kind of map out, be able to track where that individual's been and how that spread has occurred.
Yeah. And just one last thing, I'm sorry to monopolize here, but I'm fascinated by all of this. But if you want to, I know there might be some trigger words in here, but I would love to. I mean, we as a group would love to hear. You all, I feel like, worked an extreme amount during the COVID-19 pandemic. I mean, I heard somewhere between the range of 10 to 15-hour days. Describe that? What was that like?
That was intense. Probably one of the most intense career experiences, once in a lifetime, I hope, for doing COVID investigation. The amount of information and information requests that was coming in from public and from our public health partners and other community partners was so much because everybody was trying to process the information that they were receiving. Yeah. And then we had to provide guidance on that information, and there was a lot of misinformation in the midst of that. And we were trying to use the guidance from CDC and Ohio Department of Health to make sure we were consistent with the messaging that we were doing as a local public health agency to our community. So it was a lot that was happening in a day, for sure, even the 15-hour days. And we had to address it right then and there because next day there was something new that we had to deal with. So it was tough, but I'm glad we got through. And, thanks to the team.
I was just going to ask, though, I mean, like you sound hopeful about it. Like, you think back on those times and you don't sound defeated, but I'm sure that was really tough. I mean, your team was like shoved into the spotlight for a lot of that, which is not where you guys always are. And it was really hard. I mean, we heard, as the health department, we heard things from so many people constantly taking in information, trying to synthesize it to the public, and then the public responding back to that. I mean, how did you stay motivated through all of that during COVID?
I will say my team kept me motivated.
Yeah.
I know they were doing their best with the time that they had with their day. And, so we all had to kind of help each other stay motivated, and, kind of like, we can help you with this, helping each other to get through that. It was definitely tough,
Yeah.
but, we took one day at a time. Even though not knowing where the light was at the end of the tunnel was hard.
Yeah.
But we were able to also hire help to, do the phone calls and assist with the investigations. And we were able to bring on amazing individuals who also pitched in to help with that and, get us through that. So it was just not, our team of 5 of us trying to get through it. So
Yeah. Funny thing for the listeners, that was actually how I got started at the health department. I was hired on to communicate with the public and call, contact trace, and everything like that.
Yes.
So it was.
you did an amazing job.
Well, had an amazing leader. So
Just out of curiosity, and if you feel comfortable, you don't have to share this, but do you remember the most hours that you worked in a 2-week period or even a 1-week period at during COVID-19?
I'm kind of nervous for this answer.
Yeah, I feel like I've erased that out of my memory.
That's fair.
But,
That's very fair. Yeah.
In a 2-week period, what is it, like 80 hours is
80
what's
hours
the
usually.
standard, 40 hours a week, 80 hours. I mean, we're talking in hundreds probably for a 2-week period plus
Insane.
even.
Wow.
I remember more than during the pandemic when it first started, when we didn't have anything in place. This is February of 2020. When it was an emerging infectious disease, things were happening outside of U.S. There was no panic button yet that people were reaching out. At that time, there was a lot of work happening behind the scenes here because we were monitoring individuals who were coming from China. And I was on call. And I remember for a whole week, I barely slept because that on-call phone would just go off all hours of the night.
Oh my gosh.
Yeah, so it was a lot of hours.
Yeah. Well,
Kind of scary to think back to that.
Yeah.
well, you all did a great job,
Yeah,
and
absolutely.
more people should recognize that we have many wonderful people that we're at the forefront of trying to we were all sort of cogs in the machine with COVID. But I think that between your team and the nurses, your 2 groups were at the forefront of it and just absolute amazing
Thank you.
people and should get recognized for all the hard work you did in that period.
Thank you.
Yeah.
And, sort of going off of that, you talk about new and emerging diseases. Is there any difference between how you handle an older disease that we know more about, like measles, versus a newer disease, maybe like an Mpox or something like that?
Yeah, there's definitely a little bit of difference when you're first starting out a new investigation. Like, for example, a few years ago when we started working on measles, measles has been around, but it's an emerging infectious disease, especially right after COVID. A lot of outbreaks started happening. Individuals missed their vaccinations, so that kind of led to the spread of the infection further. We know what to do with measles, but we still had to learn new information, understand that information to change our investigations as needed. The epidemiology of measles is known to us and we understand it, so we did have that. But we have new challenges to deal with, especially with travel, international travel. So, yeah, there's a little bit of difference there. For a disease that we routinely investigate, usually it's pretty routine, but there's always unique scenarios where we might have to do additional intervention if needed, but there could be, depending on the disease and the time when we're investigating.
All right,
Sure.
Rad, we're going to play a game called
Okay.
Have You Had a Case of This Reported, or sort of dealt with the theory of a case, okay?
This
So
is
I've got a
scary.
list of some diseases and some well-knowns, some not well-knowns, and we'll, all you have to say
All right.
is yes or no. So
Let's do
no,
it.
Okay.
no elaboration needed, okay? So here we go. Flu,
Yes.
COVID-19,
Yes.
the heebie-jeebies,
No.
rabies,
No.
smallpox,
No.
big pox,
Nope.
Hulkamania,
Nope.
You really got yourself with that one, didn't you? Yeah.
I thought it was going to be easier to do this. Sorry, hold on. Let me just cabin fever,
No.
hotel fever,
Nope.
Hotel California.
Nope.
measles.
Yes.
Measles.
Finally
Okay.
a yes.
Okay. Mpox.
Yes.
The disease from the Progressive commercials that makes people like their parents.
No.
Okay, great. I learned a lot there. That was fantastic.
All right.
Wonderful.
Let's get a sound effect in there
I've got
for
one
that.
more. I've got one more. It's dead serious. Cooties.
Yeah. I would say that could be a general category
Hey,
for
okay.
a lot of different things.
Yeah, that's fair.
Yes.
Thank you so much for entertaining me and my stupidity.
We will find
no
a way to
problem.
edit this. Don't you worry.
Or it might not even make it at all in my
It may,
experience.
or it'll be completely uncut. It'll just be all right in
Yeah.
there.
And all you could hear is me saying no, no, no.
All right. Radhika Iyer, Infectious Disease Program Epidemiologist and Supervisor here at Franklin County Public Health. Thank you so much for coming on today.
Very welcome. Glad to be here.
All right, now we'd like to play a game. A little
game?
game on the podcast, yeah, called
boy.
Does Angela Know?
Probably not.
And you know, we've got some health quizzes from Ohio Health. Shout out to Ohio Health on their website. They've got several of these short health quizzes that we thought would be kind of fun to play around with a little bit today. The first one's called Know Your Nutrition Label. Discover how well you understand nutrition facts listed on packaged foods.
Probably not very well. This is going to be embarrassing, but let's go for it.
Well, let's take a look. Question number 1 on this quiz. What should you check first when evaluating a nutrition label? Should you check? There's
there's options. Okay, perfect. I was like,
No, fortunately, there are options, so you don't have to just fill in the blank. So it's calories,
Okay.
serving information,
Okay.
fats,
Uh-huh.
or sugars.
Okay, this is rude because I feel like you should check all of those. Which one should you check first?
That's
Are
the
you
question.
asking me which one I check first?
Sure, which one would you check first?
I would definitely check the calories first, personally, but then quickly followed by the serving size.
Okay, but what do you think the answer is?
I
to
don't
the
know because I
question?
don't know Ohio Health like that. I'm going to go with B, serving size.
That's correct.
Yay!
That's the correct answer. The serving information should be the first place you look to find out both the size and number of servings in the package.
Yeah.
If a serving is 1 cookie, but there are 2 cookies in the package and you eat both of them, then you'll need to double everything that's on the label.
Yeah. Great point. I often do that with mac and cheese, a box of mac and cheese, and sometimes there's like multiple servings in that, and
Don't
I'll
we
just
all?
sit there and eat the whole box.
Yeah,
Anyway,
it's
we're being
tough.
real, okay?
Yeah, oh, well,
Health is real.
Let's be real, yes. I mean, when they say the serving size is 1 cookie, like nobody's eating 1 cookie.
It's really
right?
hard to just have one cookie.
Question number 2. What is the FDA recommended daily intake of vitamin C?
Oh, this is hard.
Yeah, I would have no idea, by the way. Okay, so the possible answers are 500 milligrams, 60 milligrams. You know what? Let me just say, why do they put them out of order? No disrespect to Ohio Health. Put them in order. Why are you jumping from low to high?
Increasing or decreasing
Okay,
order, though.
so-
What would you prefer?
We'll start the bottom and work our way up.
Love it.
60 milligrams,
Okay.
100 milligrams, 200 milligrams, or 500 milligrams. FDA recommended daily intake of vitamin C.
Okay, so
I would have absolutely no idea.
So here are 2 thoughts that I'm using that guide me here, right? Milligrams is relatively small, right?
Right.
And vitamins are very important.
Yeah.
So that to me feels like it should probably be a higher number. Like I take some vitamin supplements. I take a B12 and D3, and I'm pretty sure my B12, it's like a tiny, tiny guy. But it's like 250 milligrams or something like that. I don't know.
And you think that
honestly.
would be at least the recommended daily intake,
Right. But maybe not because vitamins aren't always regulated. Anyway, we're not going
Maybe
into
we
that.
should tag team this and do it together
Okay.
because I don't know the answer either.
Yeah, you pick one, I'll pick one, and if either one of us get it right, then we all get it right.
I love the way you think. I would say 200 milligrams.
I was going to say 500, so
Okay,
we're going
well,
for the
let's
two
see.
big ones.
Let's see what the answer is. The correct answer is 60 milligrams.
What?
The FDA recommended adult daily intake of vitamin C, also known as L-ascorbic acid, easy for me to say, is 60 milligrams. That's
Okay.
okay.
All right, FDA.
Good to know. We went too high.
We went too high.
Yeah. Question 3. What do calories measure? How much energy you get from food? How much weight you could gain from the food? How much you will need to exercise to burn off the food? Or how much fat is in the food?
C, I know this one. How much energy you'll have, but I don't know. Say it again.
How much you will need to exercise to burn off the food?
Isn't that right? I don't know. I'm scared. I was wrong. I was so confident.
Sorry. No, that sounds right to me, but the answer is actually A, how much energy you get from the food.
Oh, this is embarrassing. Okay, I should know this.
That's okay. That's okay. I probably wouldn't have got that right either. Question 4. What serving measurement might you see on the nutrition facts label? Cups, pieces, grams, or all of the above?
All of the above.
You got it right. Congratulations.
Yay.
You can expect to see a variety. I'm just reading off of the thing. I don't know all this off the top of my head. You can expect to see a variety of serving measurements that are familiar to you, such as cups, tablespoons, pieces, and slices. These are accompanied by their metric equivalents as well. Awesome. Got that one right. Question number 5. What is another word for dietary fiber? Is it bran, greens, something I cannot pronounce, or gluten?
What? I think bran, because it makes me think of Raisin Bran, and
That
I think
makes
that
sense.
is a fiber-heavy cereal.
I think that's right, and I really just don't want to have to pronounce the third one, so
Yeah,
I'm going to
that's
say
fine.
bran. And, of course, the answer is the one I couldn't pronounce. Here, you know what? Take a
Let
look.
me try.
Maybe I'm the
Roughage.
Roughage.
Yeah, I don't know.
Anyway, that's the correct answer,
Wow.
so my apologies for not conveying what it actually was.
Didn't even have a chance there.
Let's just move on. That was a rough one. Sometimes you just got to move on. What would a 15% daily value of sodium mean? What would that mean? Does that mean the food provides 15% of the recommended daily sodium limit? Does it mean 15% of the food is sodium? Does it mean the food has 15 grams of sodium? Or does it mean you need 15% more sodium than is found in the food?
No, the first one.
I think
right?
the first
Can
one
you say the
sounds right.
first one again?
The first one is this food provides 15% of the recommended daily sodium limit.
Yeah,
That sounds
yeah.
right to me.
Yeah, that's got to be it.
Got it right. Awesome. Yeah, the other ones just didn't seem like they made a lot of sense.
No. Weird things to measure.
Question 7 out of 8. Why isn't there a percent daily value for trans fat? Is it because A, there is no limit because it is healthy? B, it's included in saturated fat? C, no amount of trans fat is recommended? Or D, trans fat is too new?
I think it's C. It's not good. Like, you shouldn't have it, right?
I mean, I'm pretty sure that it's not recommended. I mean,
Right. That's what I'm thinking, because it's saturated and unsaturated fats. That
yeah, those are what you see on the label, right?
Right. But are those collectively trans fats?
That's a great question.
I don't know. I pick C.
We got that one right.
Woo!
The Food and Drug Administration hasn't set a percent daily value for trans fat because experts recommend that Americans avoid food with trans fat and partially hydrogenated oils. Trans fat has been linked with the raising person's bad cholesterol and lowering good cholesterol, both of which increase the risk for heart disease.
Wow, I need to check my food labels for trans fats now.
Absolutely. If a food contains 20% of your percent daily value for calcium, how much more calcium can you have that day? Is it A, 80%, B, as much as you want, C, 20%, or D, none? I feel like this is a trick question
I
because it
was gonna-
seems like
yeah.
it's 80 to me.
Right,
Like
right.
that's what jumps off at
I
me.
think it's the second one. What was the second
As
answer?
much as you want.
Yeah, because the percent daily value is how much you should have, but you can always have more vitamins. Like your body just like gets rid of it if it's way
that
too
true?
much. Yeah.
See,
right? I don't know.
I don't know. Like, is it trying to be tricky or not? Really?
It is. That is tricky. It's just tricky.
Let's put as much as you want and see. I have a feeling it might be 80%, but we'll see who's right. Angela, you are right.
I was right.
As much as you want. The percent daily values listed for good nutrients such as vitamin C, iron, and calcium are suggestions for the recommended minimum amount of these minerals you should consume each day. If you want to get more calcium, that's great. In fact, it's recommended that adolescents and postmenopausal women get more calcium than the daily 1,000 milligram goal. So, as much as you want.
Nice.
How about that?
Strengthen your bones.
Collectively, it says we got 5 out of 8.
Oh,
So,
no.
not the best, but you know
Don't.
what? That's okay.
That's all right.
It's real. It's a real score.
It's a real score, and we are not experts all the time.
No, but we learn together, and that's
Yes,
what's important.
Absolutely.
Thank you for listening to the Health is Real podcast from Franklin County Public Health. We want to hear from you. Let us know your thoughts at fcph@franklincountyohio.gov, and be sure to follow us on your favorite social media platforms. And did you know that we offer vaccine clinics and education throughout Franklin County for both children and adults? Talk to a public health nurse to ask questions or schedule your vaccine appointment by calling us at 614-525-3719 or email shots@franklincountyohio.gov.